Michelle, the U.S. isn't the only country that's really trying to give affordable health care to its citizens. In fact, emerging economies are trying to do the same. And there is one person who understands that really well, and that is Adrian Gore. He is a South African businessman, as well as the founder of Discovery Health, which has revolutionized South Africa's healthcare program. Discovery Health is, in fact, South Africa's largest health insurance provider. And I spoke to Adrian Gore, and he informed me that President Obama's healthcare program was a great initiative, but it does face some challenges.
It's an expensive system, and it is fragmented, and there's a lot of people that are uncovered, and of course that's a problem. On the other hand, it's a system with unbelievable resources and talent and quality, and if you're really sick and you have access to care, the quality of care is exceptional. I think Americans often romanticize other systems to an extent, but of course it's a system with dramatic challenges, and it's hugely expensive, and work has to be done to make sure that it is sustainable.
Talk to me about some of the challenges of operating in emerging markets such as South Africa.
Look, the challenge of our healthcare system are a lot bigger. It's kind of, where in the US it's 20-80, ours is 80-20, where we have a big public system that's trying to capture 80% of the population. It's underfunded, there are all kinds of issues in it. So the basic quality of care for a large portion of the population is fairly poor. And our government is focusing on a national health insurance plan to create a proper safety net for all South Africans. Again, I think that's exceptionally important. I think being a health insurer in developing markets is difficult. You've got to build a system as you build. But I think that the focus on getting people's health right is fundamental to that.
Healthcare is extremely complex. It's extremely bureaucratic. How do you innovate in such a challenging field?
I think you can innovate. I mean, obviously, healthcare is, as you say, is a regulated, structured kind of system, but it's remarkably open to innovation as a health insurer. The field we're in, where we focus on prevention very much as part of our products, is really an open field. It is quite remarkable that, as I said before, half of death is caused by these preventable illnesses. Yet, if you look at the extent of academic studies, of real insight into how we prevent these things, it's incredibly scarce. So I would put it to you that the opportunity to innovate is dramatic. It's an open field.
You recently started a joint venture with China's second largest insurer, Ping An. How did this joint venture come about?
Well, China is one of the potentially one of the biggest health insurance markets. So it's actually at this stage very, very small. So half of all Chinese healthcare expenditure is private, and of that 80% is out of pocket. So the need for insurance is dramatic. Yet the levels of penetration of insurance are particularly low. So Ping An is as you say, the second biggest insurer in China. It is absolutely massive. They're one of the holders of one of the 4 health insurance licenses, Ping An Health. And their intent was to build a health insurance company that will grow into this space and take a leadership position. In that, we spoke about the discovery model, the vitality model, how we do that, and began to build Ping An Health in that image. So that was the thinking behind it, and we're very pleased with the progress. The market, as I said, is very small. It's about R1 billion RMB at this stage of proper health insurance premium. Ping An Health is about 30% of that. So we've got a very good foothold in, at this stage, a small market, but we expect it to grow very rapidly.